Pharyngeal diseases by Nestle Shea. Types of pharyngeal diseases: acute pharyngitis, acute tonsillitis, chronic tonsillitis, deep space infections, chronic tonsillitis, systemic diseases of the pharynx. We will begin with acute simple pharyngitis. Etiology is a droplet infection due to viral or bacteria. Symptoms and signs are the clinical picture. Symptoms include general fever, headache, and malaise, pharyngeal, sore throat, severe throat, and referred otalgia, which means that the pain in the ear is originating from the throat and not the ear. Signs: general, high fever, and flushing. Pharyngeal, hyperemia, and a true membrane which is non-adhesive and is yellowish in color. Upper deep cervical lymph nodes are enlarged. Complications: otitis media and laryngitis. Treatment: antibiotic if bacterial or if is a secondary infection on viral pharyngitis. Rest in bed, ampulant fluid intake, analgesia and antipyretic, and gurgle, which is very important to eliminate infection. Vincent angina is the second infection we will talk about. Its etiology is due to dental caries caused by an anaerobic bacteria. Symptoms: general symptoms, mild fever, anorexia, headache, and malaise. Pharyngeal symptoms include sore throat and referred otalgia with a very bad breath. Signs: fever is usually mild, and pharyngeal symptoms include necrotic ulcers on both oral and pharyngeal mucosa, covered with a false membrane. Upper deep cervical lymph nodes are enlarged and tender. To diagnose this, we need a swab, which will reveal the Vincent bacteria. Complications: spread of infection. Treatment: penicillin, mouthwash, and gurgle with the hydrogen peroxide, which increases the oxygen in the oral cavity and pharynx and kills the bacteria. Mononucleosis, Candidiasis, or rush. This is a fungal infection, usually due to some kind of precipitating factor, like diabetes, AIDS, or malignancy, or maluse of steroids or antibiotics. The patient does not complain of fever or sore throat, mild sore throat. Usually there is a hyperemia in the pharynx and soft palate, covered with milky white patches, which when removed reveals a mucosal ulceration. There is no lymph node enlargement. Treatment is antifungal, local antifungals, and treatment of the cause, whether we will stop the antibiotic or treat the diabetes. Infective mononucleosis etiology: it is caused by a virus called Epstein-Barr. The clinical picture: there is generally fever, headache, anorexia, and malaise. There is lymphocytosis and splenomegaly. Locally in the pharynx, we can find a pseudomembrane, which is a false membrane, and the upper deep cervical lymph nodes are enlarged and tender. Investigations, blood picture, and serological tests are performed. In the blood picture, we can see monocytosis and lymphocytosis. In the serological test, there is positive mono spot test and positive pole panel test. Treatment, we should avoid ampicillin because it causes a rash. Antibiotic is given only if there is secondary infection. Rest in bed and increase fluid intake, analgesia and antipyretic, gurgle, and in severe cases we can give steroids. AIDS, or known as human immunodeficiency virus, caused by immunodeficiency virus. The clinical picture is usually the patient has poor general condition. The patient suffers from repeated infections, repeated sore throats, and locally we can see in the pharynx hypertrophy of the tonsils, recurrent pharyngitis, candidiasis, and hairy leukoplakia, and Kaposi sarcoma. Upper deep cervical lymph nodes are enlarged and tender. The patient is diagnosed with the ELISA test, and the treatment usually is done in a special hospital with isolation of the patient. Now we are going to talk about chronic pharyngitis. There is chronic simple pharyngitis and TB pharyngitis. Chronic simple pharyngitis, etiology caused by recurrent infection, or patient is a mouth breather, smoker, drunk, which takes a lot of spirits, or eats spices, and maybe gastroesophageal reflux. Clinical picture reveals history of recurrent infections, irritation of the throat, which causes yawning, and continuous clearing of the throat. Locally, we can find mild hyperemia in the pharynx, or recurrent pharyngitis, and in the posterior part of the pharynx we can see small nodules due to hypertrophy of the pharynx. Treatment, of course, we treat the cause. TB, tuberculosis. This is a secondary infection due to pulmonary primary infection. The patient, we can see that he is poor general condition, and there is pallor in the pharynx, painful shallow ulcers, undermined edges, with a yellowish floor. Treatment, anti-tuberculosis drugs. Pharyngeal suppuration. This means spread of infection to nearby spaces, like peripharyngeal abscess, which is called quinsy, parapharyngeal abscess, retropharyngeal abscess, or Redwig angina. In all these cases, there is unilateral severe sore throat with referred otalgia. On development of pus, there is throbbing pain and severe dysphagia, which means decrease the ability of swallowing, and this contributes in the dropping. That means that the patient cannot swallow his own saliva. Systemic diseases which cause inflammation of the lining of the pharyngeal mucosa. There are two types: blood diseases like systemic agranulocytosis and acute leukemia, and others which have unknown etiology like Aphthous ulcer and Behçet disease. Systemic agranulocytosis, depression of the bone marrow due to idiopathic or drug-induced. Clinical picture: recurrent infections due to leukopenia, sore throat with referred otalgia, extensive necrotic ulcers with a false membrane. The ulcers do not have surrounding inflammation or redness. Investigation: blood picture will show marked leukopenia, particularly agranulocytosis. Bone marrow aspiration, which can be done by sternal puncture, which is diagnostic. Treatment: immediate hospitalization, systemic isolation with systemic antibiotic to prevent secondary infection, repeated transfusion of fresh blood. Acute leukemia. Neoplastic. The clinical picture: patient is anemic. We can see pallor, bleeding tendency due to thrombocytopenia, recurrent infections due to leukocytosis, which is not functional and immature, and sternal tenderness. Locally, we can find sore throat, extensive necrotic ulcers, and false membrane on the pharynx with multiple hemorrhagic petechiae. To diagnose this case, we need blood film or blood picture, which we can find in it leukocytosis with immature plus cells, anemia and thrombocytopenia, bone marrow aspiration, sternal puncture. This is diagnostic. Treatment: hospitalization and isolation is recommended in this case with systemic antibiotic to prevent secondary infection. Repeated blood transfusion and chemotherapy is needed, and bone marrow transplant is also needed. Aphthous ulcer is a common ulcer seen in the pharynx. The patient has good general condition. Recurrent ulcers may be multiple or single, no lymph nodes, and the patient has general good condition. The treatment: it heals spontaneously within 1 to 2 weeks, but local steroids can be helpful. Tonsillitis. Acute and chronic cases can happen at any age, but in acute cases it is more commonly in children. Streptococcal infection is the main causative organism. Clinical picture includes fever, headache, and malaise. sore throat, and bad odor of the mouth. Also, in chronic tonsillitis, we can find irritation of the pharynx, which causes yawning and clearing of the throat, dysphagia, and if the tonsils are large, they can cause obstructive sleep apnea. In both acute and chronic, there is jugular digastric lymph node enlargement and tenderness, but in chronic it is persistent. Complications: in acute, spread of infection either to deep neck spaces like quinsy, parapharyngeal abscess, retropharyngeal abscess. Also, otitis media and laryngitis can happen. Systemically, rheumatic fever and glomerulonephritis. Therefore, we should give antibiotic for an adequate time, which is 10 days, with rest and ample fluid intake, analgesia and antipyretics. Gurgle is very important with tea and lemon. In chronic cases, operation is done in the form of tonsillectomy. Membrane. This is a common question asked about true membranes and false membranes. The two true membranes are acute pharyngitis and acute membranous tonsillitis. The bacteria is relatively the same, although acute pharyngitis can be also caused by viruses. Symptoms are similar, but in acute membranous tonsillitis, we can find enlarged jugular digastric lymph nodes, and in acute pharyngitis, upper deep cervical lymph nodes are enlarged. The treatment is the same: antibiotic for 10 days with rest in bed and increased fluid intake, analgesia, antipyretic, and gurgling with tea and lemon. Also, this is about membranes, pharyngeal membranes. These are the types of false membranes which are found and the difference between each of them. This is a summary of nearly most of the diseases we took over the past lecture. Thank you and good luck.